Hello, I am Shagaf Bakour, Director of Medical Education and Phase 2 Lead at Aston Medical School. In this short presentation, I will explain how to write single best answer questions, SBAs. I shall start with the exam question styles. There is few styles to ask the exam questions. The conventional one has been the multiple choice questions, MCQs. The trend is away now from MCQs, more into the suitable best answer, SBAs, where you have all the answers are plausible, but one will be best fit. We also use in the exams the short answer questions, whereby the student write a short paragraph as an answer, and there is also the very short answer questions where the answer is not more than 5 words. It is worth mentioning that the GMC is moving towards the medical licensing assessment, MLA. There has been some delays because of COVID-19. The proposed date may be 2024. It is also important to remember that the MLA will include only SBAs, hence the talk. And also the new terminology for the OSCE's clinical exams basically is the Clinical Professional Skills Assessment, CPSA. The SBA structure includes the clinical stem or the scenario, then the lead-in, which is the question that we will ask the student, and then below it will be the 5 answers, or ideally 5 answers. One of them will be the best fit, and the others called the distractors. All are plausible, but the correct one is the best fit. After that, you will give the explanation and then preferably a further reading or a link. And here are the rules. The whole question, the whole SBA should not be more than 150 words. That's including the scenario, the lead-in, and the 5 items. We should avoid including information that is not relevant to the question to reduce the word counts. We should use the present tense. We should also avoid abbreviations without first explaining their meaning. So under including relevant information to the question, this encompasses patient details, the age, the gender, ethnicity if relevant, present complaint and the history of present complaint, relevant past medical, family and social history, patient observation including vitals, GCS, MMSC, the findings from physical examination and the results including lab and radiology results. Now, in designing the question, we should not use a question that the answer for is true or false. Use something like, what is the most likely diagnosis? What is the most appropriate initial management step? So you are inferencing that they are all plausible, but what is the most likely and the most appropriate? Then avoid the negative question. I covered that before. We should avoid saying what is the least likely diagnosis. And then once you write the question and the items underneath, check that the question passes the cover test, whereby the student should know the answer with the answers covered. Talking about the answers now, keep them short, ideally 5 as we said. They should flow grammatically from the question stem. They should be homogeneous, either talking all of them about diagnosis or all about treatment or management, or all, for example, about anatomical position. All should be maybe same length as well. Otherwise, if 4 are short and 1 is the longest, then it's likely that this longest one is the right one. All should be plausible and familiar, but one should be the better one than all the others. And the best answer should be also evidence-based, whereby there is agreement from the expert about the answer. For example, NICE guidelines or Royal College's guidelines. We should not have an ambiguous or gray area answer where the expert's disputing if it is A or B. This will be rather confusing and not informing. Then comes the last bit of information, the explanation. The explanation should first identify the correct answer, then Give the reasoning why this is the best suitable answer in some more details, and then move to explain why the other possible answers are less correct in more details as well. And then finally provide more in-depth information in the context that the question was asked. Probably give further reading link to a resource, for example, relevant guidelines, NICE guidelines, or Royal Colleges. In the next couple of slides, I'll give an example of good quality question and one of low quality question. This one is considered good question. The question starts from the stem. Sandy Hughes, 76, presents to A&E with chest pain. She describes 12 hours of sharp chest discomfort on inspiration, which started suddenly just after she arrived back from her flight to Florida. Her oxygen sats to 94% on 2-liter oxygen and her respiratory rate is 28. The lead: what is the most likely ECG finding for this patient? I'll pause a minute just for you to look at the answers. Maybe immediately we realize that they are in alphabetical order. They are kept short to an extent. They are homogeneous, so all of them about ECG findings. They are plausible. All of them are plausible. This is the explanation given to the student. The most likely ECG finding in this scenario is sinus tachycardia. This is because the patient presented with classic symptoms of pulmonary embolism, with the recent travel, with her sudden onset of chest pain that is worse on inspiration, and with the increased respiratory rate and low oxygen saturations. The 5 answers, the top 3 are can present with PE, but actually out of them, the sinus tachycardia is the most likely. The 4th one is more of a finding for myocardial infarction, and the 5th one is indicative of pericarditis. There was also a further reading, which is given herewith. So to recap, why this question is considered as good question, we start from the information in the stem. It was relevant. It was also written in a clear manner using tense, that is the present tense. This type of question is called the two-step question, and they are slightly more challenging to the student. Firstly, the student need to realize that the likely diagnosis is PE, and then to consider the ECG findings. So none of the answers are wrong for chest pain, but the good candidate will quickly rule out the findings that are not seen with PE, which is the answer 4 and 5. And out of the top 3 answers, the sinus tachycardia is the most likely of ECG finding. Then the explanation is informative and it explains the answers and why the other 4 are least likely, and also gives information and a recommendation for further reading. And now an example of a low quality question. The question starts from a stem. A male patient presents to his GP with a cough. The patient describes feeling unwell. They have a past history of appendectomy. And the lead is, what is the most likely diagnosis? Here are the 5 answers. And the explanation was, the correct answer is pneumonia, as it is statistically the most likely diagnosis a patient presents to their GP when there is cough. And now, let us together try to figure out why this is poor or low quality question. The stem is vague. The reader would need more details, such as patient age, related symptoms, smoking history, occupational history, travel history. And this past medical history of appendectomy was irrelevant. So the patient could have any of the 5 conditions given. Obviously, the most likely one for someone who has cough and feeling unwell presenting to the GP, the most common diagnosis made is pneumonia. But the question should be asking, what is the most likely diagnosis in a patient given the information and the background provided, the specific one, including the items I discussed above. So I will stop here. I hope that I gave you useful, relevant information about how to write good SBA. I would like to acknowledge that I adapted the presentation from Geeky Medics. They have much more examples if you want to visit the link. Thank you very much for listening. I hope the time will come where we can go back and deliver face-to-face workshops where you are or at Aston University.